Welcome to all. So today we are going to see I'm Dr. Arun Prasad. Today the topic of discussion is external features of the heart and the interior of the right atrium. So we'll directly move on to the topic. What is the shape of the heart? The heart is a pyramidal shaped structure. This is a shape of a pyramid. It is a three-dimensional structure of a triangle. Now this triangle is pointing towards the left side. Okay. So this is a tilted triangle, tilted pyramid, which is pointing towards the left side. So this is the apex of the heart, which is pointing towards the left side, and this is the base of the heart, which is pointing towards the right side. So this is a pyramid which is lying on the left side. And this is the pointing of the heart towards the left side. Now this is a schematic diagram of a internal structure of a heart. If you cut the heart in a sagittal section, in a coronal section, you can view there are some great vessels here. This is called the aorta, and this is the pulmonary trunk. Sorry, this is the pulmonary trunk. And we have right atrium, and this is the left atrium. And here we have right ventricle, and this is the left ventricle. So these are the four chambers of the heart, and these are the inflow tract, the means of the venous blood is coming from here. So this is called the superior vena cava, and this is called the inferior vena cava. And we have the pulmonary trunk, and these are on the back side, you can see the pulmonary veins. These are the four pulmonary veins. The pulmonary veins, why it is given red color? Because it is carrying the oxygenated blood. Pulmonary trunk is carrying the deoxygenated blood. It get oxygenated in the lungs and come back by pulmonary veins. That is why it is given in red color. Okay, these are the four chambers of the heart. We are going to see the details of the external features of the heart and the interior of the right atrium. Now, what is first is the apex of the heart. So this is a schematic picture of the heart, and this part is called the apex. As I already told you, that's like a pyramid, and the apex is pointing towards the left side. So this region of the heart is called the apex. It's a conical area. What is PMCA? It is the point of maximum cardiac impulse. This you will learn in your second year when you palpate on the intercostal space. At the fifth intercostal space, you will feel a apex beat. The point of maximum cardiac impulse is called apex beat. It is felt at which space? It is felt at the left fifth intercostal space. Exact location is ½ inch medial to the midclavicular line. There is a line called midclavicular line. We have the clavicle. You draw a straight line that's called midclavicular line. ½ an inch medial to the midclavicular line on the left to fifth intercostal space. The beat is called AB, apex beat. Okay. Now, in infants and children, the space is slightly above. It is there on the third or the fourth intercostal space because the heart size and the thoracic cage is not fully developed for the heart size. That is why it is located at a higher space. What is dextrocardia and situs inversus? I told you that it is mostly on the left side. Some children or some patients may have the heart on the right side. That is called dextro. Dextro means right. So it's called right side heart is called dextrocardia. It can be associated with other abnormalities that is called situs inversus. Situs inversus means all the visceral organs will be located on the opposite side. For example, liver is always on the right side. For the situs inversus patient, it will be on the left side. Spleen is on the left side. For this patient, it will be on the right side. So this part is called dextrocardia or situs inversus. Now, what is base of the heart? Now, wherever we have, if you see a triangle like this, I told you here. So this is like a three-dimensional triangle. So this is the apex of the heart. Now, always apex is, the base will be opposite to the apex. This is the apex. So this part is called the base. So here, heart, we told this is the apex. So this will be the base. So this part is called the base of the heart. So this part is the base of the heart. Most of the students tend to think this as base. This is wrong. Okay. So wherever we have apex, the opposite side will be the base. So this is called the base of the heart. Now the base of the heart is there on the posterior surface, so we cannot see. So we have apex is on the left side, posterior surface we have the base. It is directed towards the right side. You can see in this picture, apex is directing towards the left side, and the base is directing towards the right side. So base is directing towards the right side. And two-third is done by, so in each area what we are discussing, you should know which chamber of the heart forms that area. So here, if we divide them into three parts, this left two-third is done by, left two-third is formed by the left atrium, and the right one-third is formed by the right atrium. So if we divide them into one-third, one-third, and one-third, these two-third structures are formed by the which chamber? Left atrium. One-third is formed by the right atrium. Which surface of left atrium? Posterior surface, because it is already on the posterior surface. So it is formed by the posterior surface of left atrium and posterior surface of right atrium. The base of the heart mainly formed by left atrium. Some part is formed by the right atrium. Excuse me. Okay. Now, some more features of the base of the heart. It is lies opposite to the apex that we saw. Now, I told you it is there on the posterior surface. So if it is there on the posterior surface, it is in relation to the vertebra. Which vertebra are related to the heart? It is from T5 to T8. So T5 to T8, because T4, the angle is called the sternal angle. Below that only the heart is lying. So it will be from T5 to T8, we have the base of the heart is lying. And we have two sinuses, not two sinus, one sinus is related to that. It's called oblique pericardial sinus, and some structures called esophagus and aorta. Now here we have a sinus. What is sinus? Sinus is the empty space with a single opening. We have pericardium. When you have learnt about the pericardium, there are two sinuses in the pericardium. What are the two sinuses? Transverse sinus and oblique sinus. So this sinus, which is an inverted J-shaped sinus, which is in relation to the base, is called the oblique pericardial sinus. Now behind this oblique pericardial sinus, what are the two structures which are lying? That is the esophagus. Behind the esophagus, we have the aorta. Okay. Now, what is the part of the aorta? Which aorta will be lying here? So we have ascending aorta, arch of aorta, descending thoracic aorta, abdominal aorta. Which aorta will be lying here? It will be the, so this is the arch of aorta. It will descend as descending thoracic aorta. So descending thoracic aorta is in relation to the base of the heart. Now clinically, clinicians call this part as the base. Anatomically, this part is ideally called the base, but clinicians or the cardiothoracic surgeons will call this part as the base. So the upper border of the heart is called the clinical base of the heart. So what are the surfaces of the heart? So this class is about the external features, and we have three surfaces here. The first surface is called the sternocostal surface. Then there is an inferior surface called diaphragmatic surface, and there is a left surface. So we have a sternocostal surface, a diaphragmatic surface, and a left surface. Apex base we have already seen. So where is the sternocostal surface? So this part is done and posterior part is done. So here, from here to here, this entire structure is called the sternocostal surface. The sternocostal surface is the surface which we see on the anterior part of the heart. First, we'll see the sternocostal surface. It's the anterior surface of the heart. And this is formed by what chamber? It is formed by the right atrium and the right ventricle. So here, this chamber is called the right atrium. This chamber is called right ventricle. So it is formed by right atrium and right ventricle. Between the two, there is a groove. So what is the name of the groove? It's called AV groove. What is AV groove? Atrioventricular. This is an atrium, this is a ventricle. So the groove is called atrioventricular groove, especially the anterior part, because it has a posterior part also. So this is formed by the anterior part of atrioventricular groove, partly by left auricle and left ventricle. So it is not only formed by the right atrium and right ventricle. A small part is formed by this structure that is called left auricle and partly by left ventricle. So almost it is formed by all the four chambers of the heart. Right atrium, right ventricle. A small amount is formed by a small part is formed by the left auricle and left ventricle. It is the area of superficial cardiac dullness. What is superficial cardiac dullness? So in your clinical postings, you will be learning about percussion. If you palpate on the intercostal space, you will feel the resonant note on the lungs. When you come to the sternocostal surface of the heart, there the intercostal space is lying directly in relation to the sternocostal surface. So you will feel a dullness. Okay, so this is called superficial cardiac dullness. The finger is placed on this or percussed on this area, will feel dull note because there is no lung here, only formed by the sternocostal surface of the heart. Next, we are going to see the inferior surface. So where is the inferior surface? So I have already shown the schematic diagram. This is called the sternocostal surface. Now this surface, which is lying here on the diaphragm. So if you imagine this is the diaphragm where we have a central tendon. So this surface is called what? Diaphragmatic surface. The heart is lying on the or sitting on the diaphragmatic surface, otherwise called the inferior surface. It rests on a tendon here. This is called central tendon of diaphragm. So diaphragm is a muscular structure. It has the white colored tendon-like structure that is called central tendon. So heart is lying on the central tendon of diaphragm. Now, what are the chambers that forms here? To view the chamber, we have to tilt the heart like this and see. This is what we've done here. So we have tilted the heart like that and we are viewing the inferior surface. Now here you can see this is formed by two chambers. This is one chamber and this is one chamber. It is mainly formed by the left ventricle, partly formed by the right ventricle, separated by a groove here. So what is the name of the groove that is separating the right ventricle and left ventricle? Can we call it as interventricular groove? Because it's between two ventricles, we call it as interventricular groove. This also has an anterior part which is lying on the anteriorly and posterior part. So this is the posterior part of interventricular groove that separates the diaphragmatic surface into a left ventricle and right ventricle. So here, if you see the proportion, 2/3 is formed by what? 2/3 is formed by the left ventricle, 1/3 is formed by the right ventricle. Well, to recollect, what are the structures we have seen till now? Apex of the heart, base of the heart, sternocostal surface, and inferior diaphragmatic surface, and the chambers related to each surface. Now, there is one more small surface that is called the left surface. So, this surface, which is present here, this is called the left surface. So, left surface is formed by what? Obviously, it is the left ventricle, and we have left atrium, which we cannot see here. That is the left atrium, and this structure is called left auricle. What is auricle? Auricle means earlobe. So, okay, so this is appearing like an earlobe. So, that is why it is called auricle. So, here it is formed by left auricle, left atrium, and left ventricle. It's a very small area. Now, we have completed the surfaces and we are going to see the borders of the heart. How many borders are there? You can see there are 4 borders of the heart. We have a right border, we have a left border, we have an inferior border, we have an upper border. So first we'll see the right border of the heart. This part is called the right border. So right border is formed from here to this. So what are the demarcations? And this is the inferior border, and this is the left border. This is superior border. Which border is not seen clearly? Superior border, it is not easy to see because it is obscured by the greater vessels, superior vena cava, aorta, and pulmonary trunk. You cannot directly see in a specimen the superior border, but the right border and the inferior border and left border is slightly clearly visible. So the first border we are going to see is the right border, which is a vertical border. It is formed by what chamber? It is formed by the right atrium. So right atrium forms the right border. What is the extent of this right border? It is starting from this point. What is this point? This is the opening of SVC. And here, you're not seeing here, but this will be the area for the opening of IVC. So from the opening of SVC to the opening of IVC, what is SVC? Superior vena cava to the opening of inferior vena cava. This border of the heart, which is almost right, that is called the right border of the heart. So what does it do? It separates the base from the sternocostal surface. It's not seen here. So where is the base? The base is behind. So base is behind, and this surface we have seen. This is the sternocostal surface. So both the surfaces are separated by the right border of the heart. The next border is called the left border. Where is the left border? It's comparatively oblique or unique. It is oblique border. Okay. Now, can you tell me which surface, which chamber can form this? It is formed by the left ventricle. So it separates what surfaces? This sternocostal surface, and behind or on the lateral part we have the left surface. So sternocostal surface and left surface are separated by what border? Left border. So this is the left border of the heart formed by left ventricle. Where is the extent? It extends from this left auricle, or you can say the starting point is from the left auricle, ending in the apex. The first part we saw was the apex, so it ends in the apex of the heart. So this is the extent of the left border of the heart. Now, where is the inferior border? This border, where we have the opening of IVC to the apex, this border is called the inferior border of the heart. So this is the inferior border of the heart. It's more of horizontal, okay, where it is lying on the central tendon of diaphragm. Where is the extent? The extent is from IVC to the apex. The extent is from the opening of IVC to the apex of the heart. It is formed by right ventricle. Mainly formed by what ventricle? It is formed by the right ventricle. It separates the sternocostal surface and the diaphragmatic surface. So here it is separating the sternocostal surface, and inferiorly the surface is called the diaphragmatic surface, that is separated by the inferior border of the heart. Now here there is a small depression here that is called incisura apices cordis. Incisura is an incision like a small depression near the apex, that's called apices. Cordis means heart. So incisura apices cordis. This is a landmark for the coronary arteries. Okay. So when you learn the coronary arteries, you can learn about this incisura apices cordis. So this is the inferior border of the heart. Last border, we are going to see the superior border or the upper border. This is obscured by the greater vessels, as I already told you. That's an aorta, and we have the pulmonary trunk, and we have the SVC. So from here to this here. So can you tell me what is the extent? It is from the opening of SVC to the opening of on the, or we can say up to the pulmonary, not up to the left auricle. So it is from the opening of SVC to the auricle. This border is called the superior border of the heart. It's slightly oblique, obscured by the aorta and pulmonary trunk. Formed by what chamber? It is formed by the right atrium. You are not seeing here the behind this part is, it is not formed by the right ventricle. It is formed by the left atrium. So left atrium is behind this. So both this forms the upper border of the heart. So what are the borders? Can we recollect the borders? We have a right border, and we have a left border, we have an inferior border, and we have a superior border. So just like a box, right, left, superior, and inferior. Superior other is called the upper border. Now the borders on the chest radiograph is not equivalent to the borders of what you see in a specimen. Okay, so this is a chest radiograph. Which view? It is a PA view, posterior anterior view of the chest. Here also you are seeing the heart borders. This is the heart here, and this is the right lung, and this is the left lung. Okay, here also you can see this is one border and this is one border. Here we call them as a right border of the heart, and this is called the left border of the heart. So in the right border, there is some slight change you can see here. So right border of the heart is formed by, there we saw only it is formed by the right atrium. We didn't see about the superior vena cava. But in case of chest X-ray, you have to include SVC and right atrium. That is the difference between the chest radiograph and a specimen. In the left border, what we saw was only left auricle and left ventricle. But here you have to include two or more structures, that is the aorta, pulmonary trunk, left auricle, and left ventricle. Aorta is forming a knuckle here, that's called aortic knuckle. Okay. Then we have the pulmonary trunk. This is the pulmonary trunk area, and this is the left auricle area. This is the left ventricle area. This is the aorta. Okay. So there is a slight change between the right border and left border in case of chest radiograph and the specimen of a heart. Now, what are the main chambers of the heart? We already know that we have a right atrium, left atrium, a right atrium, right ventricle, left atrium, and left ventricle. What do you mean by intraatrial septum? What is intraventricular septum? The name says So between the right atrium and the left atrium, this is the right atrium, this is the left atrium. There is a septum that is called interatrial septum. Between the right ventricle and left ventricle, the septum is called interventricular septum. Now, what are the sulcus present in the heart? We have a sulcus that is called coronary sulcus. We have a sulcus that is called interventricular sulcus. So this sulcus, we already saw the sulcus. It is called AV groove, otherwise called coronary. Why it is called coronary sulcus? The coronary arteries will be running in the coronary sulcus. The coronary arteries running in the AV groove. That is why the other name for this AV grooves. What is AV groove? Atrioventricular groove. Between the atrium and the ventricle, there is a groove that's called atrioventricular groove. It's also called coronary sulcus. What is the intraventricular sulcus? We have anterior and posterior. So this is the which ventricle? Right ventricle. This is left ventricle. Between the two, there is one sulcus. What is the name of the sulcus? The interventricular sulcus. This sulcus will extend posteriorly also. This is the anterior part of intraventricular sulcus. And then we have one more sulcus that is called posterior part of intraventricular sulcus. So this is we are seeing from the back. We can see the coronary sulcus is almost encircling the heart, dividing into an upper part atrium and lower part is ventricle. So the same intraventricular sulcus, you can see it is extending to the posterior part, and it is called the posterior part of IV groove. IV groove or intraventricular sulcus is an anterior part and a posterior part. In this further part of the class, so we have seen the external features, borders, and the sulcus present in the heart. The further session, we are going to see about the one chamber, that's an important chamber, that is called the right atrium. Right atrium, where is it present? It is starting from this opening of SVC to the opening of IVC. This chamber is called the right atrium. It is elongated vertically. The right atrium is elongated vertically because of the SVC and IVC. We have superior vena cava at the upper end. We have inferior vena cava. So this is a superior vena cava at the upper end of the right atrium. This is the inferior vena cava at the lower end of right atrium. We also have an auricle. So this is an extra part of the right atrium. This is called auricle of the right atrium, right auricular appendage. Because it's an extra structure, it is called appendage. What is the term called? Sulcus terminalis. So here, from the opening up to the SVC to the opening of the IVC, there is a small sulcus which is created. Okay, a small depression, a vertical depression, that is called sulcus terminalis. And we have SA node inside the crista terminalis. So superior vena cava, near the starting point, there we have inside, not outside, we have a node that is called SA node. SA node is not a nodular structure. We cannot palpate the SA node. It is a modified cardiac myocyte that is generating the impulse. So it's called a pacemaker of the heart. It is the sulcus terminalis is created by a crista which is present inside. It's called crista terminalis. At the upper end of crista terminalis, we have the SA node. What is SA node? Sinoatrial node. Then we also have vertical AV groove. What is AV groove? This part is the groove. So this part, it's a vertical part of atrioventricular groove. So these are the external features of right atrium. So it extends from SVC to IVC. It has an auricular appendage. Two more terms, sulcus terminalis. Inside it is called crista terminalis. We also have the opening of we also have the SA node near the upper end of crista terminalis. We have a groove that separates the atrium and the ventricle that is called atrioventricular groove. Now, when we open the right atrium, we can open like a door. Okay. So if you open the right atrium towards the side, you will have a chamber. We can see the internal features of the heart. So this is the internal features of the heart. We are opening it from the proximal part is attached, or we can say the left end is attached, right end is taken out. So this part is called the crista terminalis. The ideal, it's not terminal crest, it is called crista terminalis. We can see an elevation here that is called crista terminalis. And we'll see what are the parts. It has two parts. Interior of the right atrium has two parts. So when you compare this structure and this structure, which is rough, this is rough part. So we have a rough anterior part and a smooth posterior part. So the rough anterior part is there, and we have a smooth posterior part. Comparatively, this is a rough structure, and this is the smooth structure. The other name for the smooth posterior part is called sinus venerum, SV. Sinus venerum. Why it is called sinus venerum? This is the area where most of the veins will open into the right atrium. That's why it's called sinus venerum. And we have rough anterior part, which is formed only by the muscles. That's called pectinate muscles. In the rough anterior part, you can see multiple muscle bundles are running. The name of the muscle is called pectinate muscles. The pectinate muscles will arise from the crista terminalis and go like this. It's separated by the crista terminalis. So this is the main internal feature of right atrium. We have a smooth part that is called sinus venerum, and we have a rough anterior part which is formed by like finger-like process, like that is called pectinate muscle. They arise from the crista terminalis and move towards the interior of the right atrium. The next part is septal wall. The same picture we have seen now. It is opened out like this. Here the attached portion is there on the right side. So that is a slight difference. So there is a right side portion is attached and left side portion is taken out. Now this wall is called the septal wall. The part of the wall present here is called the septal wall. Why it is called septal wall? Because it is formed by interatrial septum between the right atrium and the right ventricle. Right atrium and the left atrium, there is a septum called interatrial septum. So this wall present is here is called the septal wall. In the septal wall, we have some structures. So how many structures are there? 4 structures are there in the septal wall. That is called fossa ovalis, annulus fossa ovalis, or is called limbus fossa ovalis, and triangle of Koch and torus aorticus. We'll see one by one. We can see a oval fossa here. So this oval shaped fossa is called fossa ovalis. It is formed by the foramen ovale. That structure is called fossa ovalis. Now, it is surrounded by a annulus, a slight elevated part that is called limbus fossa ovalis. Limbus means margin. So this is called limbus fossa ovalis or annulus fossa ovalis. Fossa ovalis is a small depression on the septal wall of right atrium. It is surrounded by a small elevation that is called limbus fossa ovalis. And what is triangle of Koch? Triangle of Koch is a area which will be present here. So that is called triangle of Koch. This is the area where we have the AV node, atrioventricular node, and we also have torus aorticus. We'll see one by one. Now first we are going to see the, so this is septal wall, fossa ovalis. Now fossa ovalis, you can see a small depression here in this area. This area is formed by a depression. The depression is called fossa ovalis. Previously in the embryonic life, this is actually a foramen between the right atrium and right ventricle where the blood will flow freely. Later on, at birth, it will close. It is closed by a septum that is called septum primum. The fossa ovalis is formed by a septum that's called septum primum. It is site of a foramen that is called foramen ovale. Now, what is limbus fossa ovalis? It is a slight elevation. You can see here. This is a slight elevation which is present on the margin of the fossa ovalis. It's called limbus fossa ovalis. It is formed by the free edge of septum secundum. When we learn the embryology of the development of heart, we have 2 structures that is forming septum primum and septum secundum that will close the foramen ovale. So limbus fossa ovalis is formed by the free edge of septum secundum. It also forms the upper and lateral margin of the fossa ovalis. Now the next structure we are going to see is the triangle of Koch. This is slightly an expanded part, but it's a very small triangle. So this triangle is called the triangle of Koch, or the Koch triangle. Now front is formed by the base of septal leaflet. This is the tricuspid wall leaflet, and this wall is called the septal wall of tricuspid wall, or septal wall of leaflet of the tricuspid wall. Now this is the base of the triangle of Koch. That is the first margin. What is the next margin? Behind it is formed by the coronary sinus opening. So here, this is the opening of the coronary sinus. So this is the coronary sinus opening. So this part is forming the second boundary of the triangular pouch. So base of septal leaflet, then coronary sinus opening. Above it is formed by a tendon that is called tendon of Todaro. So this is tendon is a subendocardial ridge which is there, that is called subendocardial ridge, that is called tendon of Todaro. Todaro. Why we need to know all these things? Because this is a side triangular pouch. We have the AV node or atrioventricular node. If you want to do an ablation procedure like AV nodal ablation in treatment of arrhythmias, we have to approach this triangle to find the boundaries. This is where the AV node is located. Then last is called the torus aorticus. Torus aorticus is a slight elevation above the limbus where we have the starting point of ascending aorta. Ascending aorta starting here, that is forming an elevation that's called torus aorticus. It is present on the anterior superior part of septum by a non-coronary sinus of the ascending aorta. Now, what are the openings in the right atrium? We have right atrium. So, right atrium is like this. The first structure that is opening from here, from the top, is called the IVC opening. We also have an opening, sorry. So, this is the superior vena cava opening, which is present on the top. We also have inferior vena cava opening. We also have on the interior a small sinus that is called coronary sinus. And last is the right AV orifice. Through that, it is passing from the right atrium to the right ventricle. So this is the opening of SVC and opening of AVC, and then coronary sinus, right AV. We also have small openings in the right atrium that is called venae cordis minimi. So first, this is the opening of SVC, or is called the superior vena cava. Here there is no valve. Now, opening of inferior cava is guarded by a valve that is called eustachian valve. Opening of superior vena cava, there is no valve. Opening of inferior vena cava, it is guarded by a valve. It's not shown in the picture. This valve is called the eustachian valve. Now, here one more sinus is there. This is the opening of the coronary sinus. Okay, so this valve is called the eustachian valve, and this valve is called the Thebetian valve. Okay, so we are seeing the eustachian valve as well as valve of the coronary sinus. The valve of the coronary sinus is given a name called Thebetian valve. And right AV orifice. What is right AV orifice? Between the right atrium and the right ventricle, there is a valve that is called tricuspid valve. That forms the right ventricular AV orifice. If you look closer, there are small openings in the posterior wall. That part is called venae cordis minimi. It is a vein which is there in the heart. A small opening is called venae cordis minimi. This is a intraoperative picture of the small venae cordis minimi. You can see a small opening here. So this is the opening of venae cordis minimi, and this is the opening of the coronary sinus. Here one more picture is showing the opening of the superior vena cava, opening of the inferior vena cava. So this is the opening of superior vena cava, this is the opening of inferior vena cava. The name of the valve is called eustachian valve. This valve is called eustachian valve. We have a coronary sinus opening that is guarded by a valve called Thebetian valve, and venae cava minimi. Now, what is the difference between the sinus venerum and the rough anterior part of the atrium? Now, this is the rough anterior part, this is the smooth posterior part. Rough anterior part is derived from the primitive atrium. Developmentally, they are different. It is formed by the primitive atrium. That is why we have more pectinate muscle in the rough anterior part. What is there in the smooth posterior part? The smooth posterior part is actually not a chamber which is directly formed from the swelling. It is the right horn of sinus venosus. Sinus venosus will get absorbed into the right atrium and forms the smooth posterior part. The next difference is that presence, okay, all the venous channel except the anterior cardiac veins open into the superior vena cava. So here you can see this is all the venous channels. Now only we saw IVC, SVC, coronary sinus, vena cava minimi, everything opens into the smooth posterior part. But in case of rough anterior part, we have only a rough, this is helping in the contraction of the right atrium. It's not that the anterior part is not having any function. It is contracting and pushing the blood to the right ventricle. So present a series of transverse ridges and pectinate muscle that arise from the crista terminalis and runs towards the auricle. Interior of the auricle presents a sponge-like structure. Here, this part, if you take a cut section, you will see a sponge-like structure of muscular bridges. So to summarize, what are the things we saw today? So we'll see the summary of this. To summarize, how many surfaces are there in the heart? We have three surfaces. What are the three surfaces? We have sternocostal surface, we have inferior surface, and we have left surface. We have three borders. What are the borders? We have a right border of the heart, we have a left border of the heart, and we have an inferior border. How many sulcus are there? Sulcus also three. Can you recollect the sulcus? We have the coronary sulcus and anterior part of intraventricular sulcus and posterior part of intraventricular sulcus. Coronary sulcus will go like this. And in the right atrium, there are two chambers, an anterior part and a posterior part. We have a rough anterior part and a smooth posterior part. Okay. So this summarizes the session of external features of the heart and the right atrium. Thank you.